Yeah. And yes, we are live. Oh my god. Um oh yeah, come outside. You hear me? Yeah, it's perfect. So we are live. Welcome to the Psyche Circle exclusive webinar. Yes, so if you are here, if you can hear me, let me hear in the comment section. Let me know in the comment section. Let me see you in the comment section. I want you to be able to tell me. I said, I can see you and I can hear you. If you can see me and you can hear me, let me see it in the comment section. So, today we are talking about knowing your sickle cell child clinical baseline. You see, every time, oh God, let me adjust. Every time we talk about clinical baseline, a lot of us don't know the importance of it. Sometimes parents tend to go because especially when we are in support groups, we have different people living with sickle cell, and I will never stop talking about how sickle cell it actually affects individual differently. So it means that the way sickle cell affects me is different from the way sickle cell will affect another person. And what is that thing that you just need to know when it comes to your clinical baseline? So most time we have people talk about, oh, my child has 80% PCV and my child did not collect blood transfusion. My child, I don't know what kind of hospital that I'm using. When my child has the PCV of 24, the doctor was saying that we should go and do blood transfusion. I cannot even bother about it. Sometimes, how I always say it, when you don't have the right knowledge, your good intention can be an arm. So it means that you can arm your child with a good intention. Even though your intentions are right, your intentions are great, your intentions are wonderful, but because you don't have the right knowledge, you are making decisions based on emotions or based on what another people say, not based on the right and the truth information. Do you get? And this is the reason why it is important for us to understand there's something we call baseline. What am I? There's something, we talk about stable PCV, a baseline BCV, a baseline hemoglobin. It means the same thing. That time, what is that normal figure for your child, in pertaining to your child? So it means that my PCV, my normal PCV, when I'm not feeling sick, when nothing is wrong with me, can be, let's say, 28. And another person living with sickle cell, PCV, can actually be what? Can actually be 24. It has nothing to do. Now, if me that with my PCV of 28, if my PCV is at 22, I will take blood transfusion. Believe me, I will take blood transfusion. 20, I will take blood transfusion. But do you know that somebody with a baseline, PCV baseline of 24 or 23, at 20%, they are likely not to take blood transfusion. And this is the reason why we are discussing about this topic today, so that you understand what this baseline is. How does it affect your child? So when someone says, "Oh, my child is at 80%," some people has a baseline of 20%, and 80% they are likely not to get blood transfusion. But me, with a baseline of 28%, in fact, 18% is already screaming emergency, because it means that 10% of blood has already 10% percentage of blood, which is almost equivalent to almost 3 parts of blood, has already been lost. So they have to replace it either way. So most times we make decision from a place because we compare our child with sickle cell without us even understand the baseline, and that thing can actually harm a child. Yes, there's a case that happened. I'm not saying, see, everything I'm saying is as never to be to scare you, it's for us to learn from it. There's a case that we had, and the child has a PCV. The person has a PCV of 20, and the nobody nobody is talking about the baseline. Nobody was talking about any other thing, and they just assumption, because sometimes it can happen in the hospital. They assume that 20% the child will the guy should be okay. In by tomorrow, they will definitely get a blood and transfuse the child, the same person. Guess what? In the middle of the night, they lost the same person. They lost the same person to anemia. I be wondering, oh, but another warrior is going to tell you that, oh, the last time my PCV was 18%, I did not take blood transfusion. Another will say, ah, the last time when my PCV was 15%, I did not take blood transfusion. Do you realize that we have lost some people because of the same thing? Now, after that, we got that to know that the baseline of that person was 32. So someone with a baseline of 32 at even 25 is already extremely low for him. Because at that 20, not to talk of 20, that's almost 10 pints of, oh, that's almost 4 pints of blood lost. What of blood that has been lost in space of days. So it means that they have to give another blood to replace those ones. And because of assumption from the part of both the medical or the patient, I don't understand. Because of the assumption, we lost someone. And this is the reason why this is important for you. See, there is something I want to tell you. Every time I go to the hospital, there are sometimes I go to the hospital, sometimes like, oh, no, she doesn't need blood transfusion. My father will insist she needs blood transfusion. You see, those days I used to wonder, is this man is spending money? But the doctor say it's not. And I said, no, I know my child. I know how she's breathing. She's not breathing well enough. No, 20% is too low for her. And they insist, and they have to get that blood transfusion done. Why? It's coming from a place of knowledge. I know. See, sometimes I understand resources can be a constraint. I understand that resources might be an issue. But sometimes there is nothing what you have to know when to actually request for this help. You understand? You have to know when you're because see, and sometimes some people they know this normal PCV is 25. Oh, because they don't want the child, they now say that the PCV is maybe 20 or 18 because they don't want the doctor to say that take blood on you. They will lie about it. And before you know, you start adding prayer on your child. Complications, because when there is not enough blood in the body, they have to work extra in order for them to pump blood to this your heart. And that's why we have people with sickle cell coming down with what we call cardiomegaly. The one has enlarged liver. That's why we have so many disease. That's why you see people with sickle cell. They have heart attack. Yes, they have issues with their hearts. they start having palpitations. It's because of this. So the body needs blood. The body needs blood. But everything we are going to talk about today, even though I mentioned PCV, is going to talk about every baseline in regard to your child health. Why you must know it, why it is important, and everything. So let me share my slide. Let me share my slide. Okay. Yes. Can you see my slide? Can you see my slide? Can you see my slide? So, Sakia Sickle webinar, knowing your sickle cell child clinical baseline. So, let's talk. What is clinical baseline? Let's discuss about it. The clinical baseline is your child usual health status, their normal vital signs, lab results, symptoms, and behavior when they are not sick. This is what will help you in monitoring the health of your child with sickle cell. This is where you can easily know something is wrong with my child living with sickle cell. This is when you can know that my child is at their optimal good health status. Every child with sickle cell has a unique baseline. Yes, we don't have the same baseline. My baseline is different from your child baseline. Your child baseline is different from my own baseline. Another person living with sickle cell has a different baseline. So you must be able to understand your own child baseline, the health status, that clinical baseline of your child in related to your child, not in related to me. And sometimes you see, when it comes to me posting about some things, there are some things I don't usually post out. I don't go outside and go and say, "Oh, I had 20% blood chance. I had my PCV was 24, and then I did not have blood transfusion," because I know that it can be definitely, it can be highly misleading, especially when you don't have the right information. You don't have the total. Sometimes we have we have access to half truth of a situation. Half truth. That's what we have access to. We did not have access to the right information. So we have as and half truth can be dangerous because you are going to keep running with one side of the truth, forgetting about there's something we call the total truth. Every child with sickle cell, understanding this helps you to spot changes that need attention. So even though if your child is not sick, immediately you know there is a changes in the baseline. A child is not sick. You go to the hospital, you run a PCV. PCV is 40% or maybe 60%. At that time, they have to admit the child because it's already telling you that something is wrong, even though the child looks very, very healthy. And that sometimes when that the baselines are very, very okay, and the child can be in crisis. It doesn't mean that because the baseline are okay, your child with sickle cell cannot have crisis. Because if you're one of those people that take our sickle cell, I know everybody that is in sex cycle, we took the sickle cell crisis prevention course. We understand that there is something that we call triggers. This trigger can be external or internal, environmental, or whatever it is. And see, even though if your child has a very strong clinical baseline, they might be exposed to their triggers and it could actually send them to pain. So it doesn't mean if all these lab results is showing everything is well. That doesn't mean that your child with sickle cell cannot have crisis, because these are some of the mistakes that parents they say, hey, we test for malaria, we test for the FBC, full blood count. The doctor said that they don't know exactly what is wrong, right? The child with sickle cell, yeah, the child with sickle cell might definitely enter into the rain. They might actually have emotion. They are be stressed emotionally, and this can actually be what causes their crisis. So it's not always about the clinical baseline, so that we know exactly why is knowing the baseline important. Why does it important for us to know the baseline? Detect complication early before they become emergency. I am always on the prevention side. Yes, I'm already on the prevention side. If we cannot prevent it, then we must be able to detect early. Most of the complications that causes issues are because they are not detected early. Yes, somebody that detected the AVM at stage 1. It's not the same thing with someone that detected AVM at stage 4. They are totally different. One can actually be managed maybe with rest, don't use the leg maybe for some months, and another one has to undergo surgery in order to correct it, has to undergo hip replacement surgery. Yes. So we must be able to understand that when you know this baseline, it helps us to detect complication very, very early before they turn to medical emergency. Avoid unnecessary panic or delay our hospital visit. When I was doing my IT then, I think when I did my first IT at the hospital then, and then we're at lab. So all of us, we are doing, everybody, we are trying to check for our body. We run some tests at the lab. We check our BP. We just wanted to do a lot of things. And guess what? I did my PCV, and my PCV was 25%. And everybody was panicking. Yes. All my classmates, they were panicking. Oh, Kemi, what happened? How can your PCV be 25? But it is, in fact, I was happy because as at that time, my PCV used to be 20, 22. And I got to detect that my PCV the PCV is 25. Hey, me that was happy. Everybody was happy. When I took that result home, everybody was happy in my house. What are those things that they explain to us? They explain to us that as a woman, your normal PCV should be 35% and above. Man should be like 40% and above, right? But here is somebody with 25% PCV. She's doing well. She's not exhibiting, but I'm fine. But that's my normal PCV. It took a lot of time for Kemi, when you get home, Kemi, are you eating? They will be calling me, Kemi, are you eating vegetables now? Have you taken histamine? Have you done this? You need to buy blood tonic. I was just looking at them. So after like 2 days or 3 days, I had to call them and I said, come, this thing is normal for me. It's not normal for you, but it's normal for me because I live with sickle cell. This is actually my normal, my stable PCV. And that was like they were, oh, we didn't know. Yes, so I would not need blood transfusion at 25%. But somebody with that sickle cell will be needing blood transfusion at 25%. And you understand the difference? I have to explain that. So now, if because I understand, I could have necessarily, my friend did not understand, and that's why they were having panic. They were panic. They were afraid. Believe me, they were afraid. They were genuinely afraid for me because they don't understand 25%. What is going on? What did you do, Kemi? And they were trying to ask questions. Your period. I know it is something that happens. Or delay hospital visits. Now, if your number, my table PCV is 25, I went for a checkup and they said it's 18. Then I know that I should be at the hospital, right? If you don't have this basic knowledge, a child that should be at the hospital and should be collecting blood transfusion, you will take the child home and go and be giving what you're not supposed to do. There is a time, there's something we do with in sickle cell where we do all these blood boosting leaves, blood building ways, whatever we said we are doing. I don't understand. We do it every time, but there is a time for those things that you are doing. There is a time where you need to boost blood. There is a time why the child needs blood transfusion. Yes. If there is a slight difference, like the child is like 2%, 3% difference, then you can totally say that you are doing a blood boosting. You want to go home, you want to go and boost it, you want to try your hematinis, you want to do other things that work. But If the amount of percent that has been drastically reduced, the child has been showing symptoms of anemia or severe anemia, at that point your blood boosting can no longer work. And you, if not, you will be putting your child at risk, including the risk of death. Number three, it helps us to communicate effectively with your healthcare providers. I'm talking about your doctors and people that gives you provide health for you. Now, imagine the doctor goes to the hospital. They are screening the child. They are asking you, what is the stable PCV of your child? What is the hemoglobin baseline of your child? It means the same thing. It means the same thing. In Nigeria, we use stable PCV. We use PCV. What that is the packed cell volume. In some other country, they use hemoglobin. It actually means the same thing. Okay, it means the same thing. So now, when you go to the hospital, you understand, and the doctor, the first thing that helps them to make accurate judgments, especially for a child with sickle cell, is for you to know the baseline. So when they're asking you questions, they want to ask you, what is the baseline? What is the stable? What is the stable PCV of this child? What is the stable of this person? What is the stable hemoglobin of this person? What is the stable blood pressure of this person? Knowing that, help them to be able to make important decision, right? And also help you. And see, when you know all this baseline, when the doctor is saying that we want to do this, you or yourself, you already know that this is needed. In fact, you can also you can advocate for your child better when you understand baseline. You know that, oh, my child PCB is 28%. Now, so now, when you understand that, oh, the normal PCV of my child, sorry, I need to communicate with something. The normal PCV of my child is 28, and at 20%, and the doctor is telling you that there's a need for us to do blood transfusion, you already know that there's a need for blood transfusion. There's no need for you to argue again. There's no need for you to say that the doctor is not explaining to you. The doctor is not telling you what to do. No, you already know. Even you're already advocating for blood transfusion because you know that is the right thing to do at that moment. Right? You already know that is the right thing to do at that moment. So you can make a better decision. You can communicate effectively, and both of you can come to an understanding and make things work for you. Empower you to make confident decision for your child's care. It's not just only about the doctor, it's also about you. You know exactly when it is an emergency. You know exactly when what you can actually manage at home. You know the right thing to advocate for in case you are at the hospital. Now, how does this help healthcare providers? Anytime I'm talking about healthcare providers, I'm talking about the people that help your child, the nurses, the doctor, and every other thing. Now, knowing your child baseline guides accurate diagnosis and treatment. So when I'm asking people with sickle cell, people in the second cycle, they understand. Then you are calling me and I'm asking you, what is your child stable PCV? What is your child stable this? What is your child stable that? And some you don't understand. Ha! You don't. Because immediately you can give us, then we are able to make accurate decision and treatment. We're able to make that, okay, this is, I think this is what you're supposed to do. You should be at the hospital, you should do this, you should do that. Because That one is a guide. It's a guide for us. It tells us what to do per time. It helps us to distinguish between new problem from usual symptoms. Now, imagine that even though you every time your child PCV is always 25, and suddenly every 2 weeks your child PCV start dropping. After another blood transfusion, it drops back to maybe 18%. You already know something is wrong. And then you start asking questions, you start telling the doctor, oh no, this is not right, something, and they until they are able to know what is it and fix it. After I gave birth, my stable PCV used to be 29, 28, 29. Immediately after I gave birth, my stable dropped. Yes, it dropped to like 18%. And at that point in time, I was struggling with so many things. I was struggling. So it means that after I take this blood transfusion, then it comes back. By the time I check again 2 weeks, then it's back to 18%. Then I have to said, okay, what is wrong? Go back, went back to 18%. Then it takes some people, like the medical team started checking, and they realized that okay, we have to stop this blood transfusion because we realized that this is exactly what is happening, and they were able to come with a decision. And gradually, this PCV continued to improve. Believe me, it continued to improve. So we started following the plans, what I was supposed to do, completely with my diet and every other thing, and there was an improvement. Presently, it might not be that high compared to, but it is reasonable high now. It is reasonable high presently. So I'm still working towards to be able to get that. But I understand tried that and every other thing as taking that. And it's okay. You understand? So it helps us to distinguish between a new problem and from a usual symptoms. It's very, very easy for us to know that something else is affecting this body. So what is that thing? Let's look for it. We look for it, we solve the problem, and the child can continue living healthy again. Inform medication and treatment adjustment. I like I said, there was an adjustment in my medication and treatment because of what was happening to my health. Yes, because of what was happening with my PCV and every other thing, they were able to make an informed decision with my medication. Medication has to be run. There were some other tests I run. After running this new medication, they adjusted my dosage. This is what they are supposed to do. Like, oh, this is what we are supposed to increase. Instead of taking one per day here, you are going to be on this for 3 times per day. Instead of you to do this, you are supposed to follow this. And then this thing help us to adjust the medic treatment. And before you know it, I started improving. In fact, it's not only my medication that was adjusted, including my diet. I had to adjust my diet. I had to eliminate something totally from my diet. I had to have a change of lifestyle because I was able to understand this baseline. Now, improve emergency care decision. You rush a child living with sickle cell to the emergency, and at that point in time, they are asking you questions. What is it? See, if somebody is having a 18% PCV when they get to the emergency room, and the stable of that person is 24, for example, it's possible for them to suggest just one bag of blood and say, take this 1 pound of blood. But if that person is having like 28, the stable PCB is 28, then at this point is that they want to suggest 2 or 3 pounds of blood so that they can actually help the body to recover faster. Do you see? When you know it, when you are able to tell them this is the baseline of my child, they can easily improve emergency care decision. Support tailored care plan that are tailored for your child. You don't have to compare your child with another person. I have friends that their normal their baseline are very, very high compared to me. Their blood baseline is very, very high compared to me. And I have some that their baseline is very, very low compared to my own. And we both understand we are all doing well in our own state. Now that I have a stable PCV of maybe 25 doesn't mean I'm not doing well. And if somebody with a stable PCV of even 30, as someone with sickle cell, is doing well. Then another person who has a stable PCV of 22 is also doing well. The only time we get border is when this 22 decreases, when it decreases. Okay, because it means that at that 22, they can function optimally. So with this, you are able to create a tailored care plan for yourself, for your child, and help them facilitate communication among medical teams. Medical teams are able to make a decision. Like in my own case, my baseline dropped, and then they are, it's not just about one person talking. They have to come together every now and then and make decision. They have to decide, this is the best process we are supposed to do. This is what was. Let's do this. Let's see the improvements. Then you come back after 1 week. Then we check. Then we do this. It helps them to communicate. You're able to communicate what is happening. What is this? Okay, somebody suggests, okay, no, I think at this point in time we have to pause this and let's see what can happen. This is exactly how we are going to help. Let's increase this dosage of medication. It helps. That is exactly how we are able to get that. Now, what are those things that you need to know? Element of your child clinical baseline. If you are in Sickle, you realize that last week we talked about oxygen saturation. We talk about oxygen saturation. That we are mentioning it again. So we want to talk about hemoglobin and blood counts. This is what we call PCV, because you are checking for the hemoglobin level of a child, of some of your child. So in most of our hospitals in Nigeria, they use the word PCV, packed cell volume, is the same thing. So it's just like the parameter is what's different. So you can easily convert whatever you get in packed cell volume to get a figure in hemoglobin. The same thing, when you know the hemoglobin, you can easily use it to to know what the PCV is. They are literally mean the same thing. Now, listening or blood count. This helps us to determine the level of anemia in the body. You want to know if the child is anemic or not. And also, it also helps us to know if the child is having a severe breakdown. Imagine you get to the hospital and you did a PCV test on day one, and the PCV was 30%. Then day two, day three, they could actually see that, oh, let's repeat this PCV. They did the PCV, and then it was no longer 30. It was now 30, 20. It was now 20 or 18. Do you know exactly what happened? At that point in time, they have to run ETA. They have to know that, okay, something is responsible for breaking for this sudden decrease in the PCV, and they have to look for it and solve that problem, right? It's easier to make a very fast decision. Hemoglobin and blood counts. Two, oxygen saturation. There is a level where your oxygen saturation must be. If it is less than a particular level, it's already saying problem, 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 emergency, emergency. So you know exactly what to do. Typical pain pattern and triggers. Like when we explain, I talked about we have different kind of triggers that affect people with sickle cell. What is my trigger might not be another person's trigger. Another person's trigger might be totally different from my own triggers. And it is important for you to know your child pain pattern. So sometimes some people will tell you that, oh, immediately they have malaria like this, then they start having pain. That is knowing their pain pattern. Some people realize that if they don't drink enough water, they will end up at the hospital. That is typical pain pattern. You must understand what is the pattern. How does it pattern? There are some people that the only place that they only have pain at this place, maybe at the leg or at the hand. When you start having different pain in other parts of the body, sometimes you might want to check for the reasons. So it means that you must be able to understand your child typical pain pattern. What is the type of pattern? See, when I was teaching us at the sickle cell crisis prevention class, and I mentioned about, I know all of us have access to the sickle cell diary. Yes, we all have access to it. And I started talking about keeping a diary for your child with sickle cell. People were looking at me, oh, why do we have to keep diary? What is all that thing? Why must you keep diary? You must keep diary because diary can help you to see the patterns. You will forget your brain before you think about your child, before you think about your husband, before you think about your work, before you think about how you want to uh, talk about your boss before you think about your business, before you think about your siblings. Your brain is so busy. So sometimes you say, I know it I know it offhand. It's a lie, you did not know it. The time you are asking you now, you are forgotten, and it's not your fault. It's because you're thinking about so many things at the same time. The same you are trying to ensure that all the other children, they are okay. The child with sickle cell, she's doing okay. The siblings, they are well. You have to attend to your husband, you have to attend to your work. It's that your brain is busy, and it's okay. So that is why you have to put it into written. Write it down. Write it down. You can easily bring out your book and start checking. Okay, oh, what is this pain pattern? What exactly led to this pain pattern? By the time you start writing it, after 1 month, go back to your plan and start checking. My child has crisis at this day. Okay, what are the things that causes the crisis? What are those things that happen a week before that pain? Then you check, and then you can easily make reference. Okay, let's check with 2, let's check with 3, let's check with 4, and then you're like, oh, I think this thing is a pattern. This, because of, we need to start avoiding this. In fact, you can easily know, okay, this would trigger my son, my daughter crisis, and then you prepare for it, right? Usual appearance, there's a way we appear that make us know that we are okay. See, somebody with sickle cell, sometimes they're going to be like a thing, like some of us that, we are constantly drinking water and we have clear eyes. So now when you see a thing of yellow in our eyes, it's already telling us something is wrong with our body. Then the urine color, when it becomes change, yes, when you see our skin, it becomes so yellow or it becomes pale. It was at this time you already know that, okay, you can use the usual appearance. Remember when we talk about how to know your triggers, we talk about observation. So this is exactly what you are doing. Observe the usual appearance. What is that thing that is different? You can easily know that when the eyes is yellow. You can easily know when the skin is jaundice. You can easily know when those things that are not normal, those colors appear. You can easily pick it that something is about to go wrong. Normal vital sign, yes. Normal vital sign, heart rate, temperature. I'm still going to talk about myself, using myself as an example for this one. You see your normal vital sign, you must know it. You must know your normal range. You must know your child normal range. Why? I remember when I was at the hospital, and then there was this nurses. The nurse came. What is it called? My blood pressure was kind of low, and then she was worried. Why is the doctor not doing anything? This your blood pressure is too low. And just like I said, it's actually not too low for me, because that is actually within the range of my. He said, no, 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 no. I'm just thinking maybe I have to do this. But don't worry, let me go and I understand. Then the nurse went to go and meet the doctor, and the doctor said, okay, check the cat and start seeing. Then it was there. It's just that I have a lower blood pressure compared to, which is okay, for me. So as some people will say, oh, the normal blood pressure is 90/60. Do you realize that you can sometimes you can't get those figure of 90/60? You have to get maybe 92/68, 92, something like that. That's how you keep check. You know. And some people can even have lower 80 something over 50 something. It doesn't mean that it is low. It just show their body. Now, because of the presence of anemia and every other thing, it is considered that a lot of people with sickle cell often deal with low blood pressure, right? Yes, low blood pressure, and that is okay. But if you don't know the signs, this is for adults, especially when you have adult children with sickle cell. This is for them. You must be able to know. Now, you remember another thing I asked us to do: take the temperature of your child daily. It helps us to know when the child is going through. See, it's not everybody. When I was younger, my body used to be extremely hot. If you touch my body now, you will feel like I'm sick. Even though when I was at school, sometimes it's a perfect excuse for me not to do labor. I hope no, you did not hear that. Because if you touch my body, the body is warm. So when the teacher touch me, I'm like, oh, Kemi, she's sick. Go and allow her to sleep. If I really want to sleep, I don't want to sleep. I just say, no, that's my normal body temperature. I'm like, no, you are forcing yourself. But it is normal. And because of this reason, is the reason why we have to get a thermometer in our house. When I was in primary school, secondary school. So we are constantly, and at that time, blood my temperature is always 37.1. and it's okay. 37, 37.1, it's okay, right? Compared to now that I have temperature of 36, 36.8, 36.7, and it's okay. So see, if somebody else who doesn't know the baseline of the child, when they see 37.1, they can freak out. They can think that maybe a fever is coming. But when you know the particular baseline for that child body temperature and heart rate, heartbeat, when you know it, by the time you measure it and you see a increase, you can easily tell that something is wrong. Now I'm always taking temperature, it is 37. If it's not 37, it is 37.1. By the time you do my temperature one day and you realize it is 37.4, it already shows problem. That's it. It's already telling you that there is a problem. So what do? Solve it. But now, if you don't know your baseline, you can easily confuse that 37.1 as a sign of problem, as a sign of fever, whereas there is no fever. It's just that child normal body temperature, and it's okay. So when you do this thing, when you follow up, when you check, you can easily understand what you're supposed to do. Activity tolerance and hydration status. I'm going to measure, if you have a child with sickle cell, you must constantly measure their hydration status. Are they well hydrated today, or are they not well hydrated? You must know it. Activities tolerance. What is that thing that is affect? What is that thing that they can affect? See, if you are very close to me, you will be able to know that there are some activities that I will not do. Even if you dash me money, I will not do it. Except maybe you want to dash me $1 million, that I'm already knowing that after I do this, I will have to go to the hospital and to the emergency room. By the time they finish treating me, I still have enough money to flex around. Right? You must be able to know the tolerance of activities of your child. What are those activities? There's something I used to say. There is a difference between play and stress, and there is a difference between stress for individual. What can be stressful to me might not be stressful to your child with sickle cell. So you must be able to understand what is that thing that is stress for my child. What is that thing that is normal? And people will always think, why is that child? The child is too playful. The child is always doing rough play. But do you know that rough play might actually be normal activity tolerance for that child? Normal activity tolerance. So it means that if the child continue to play, nothing will happen to the child. So what are you supposed to do? Because you know that the child is undergoing play, it's possible for them to sweat a lot and keep losing water. You hydrate them. So you also want to know their hydration status. Some people with sickle cell, they want to go and play ball and they keep playing ball, and that's okay. That's the activity tolerance. But you have some people, they cannot even sweep the floor. They cannot even sweep the floor, because if they sweep the floor, they start having backache. And it's okay, right? It's okay. So you must be able to understand what is that thing, activity tolerance. What is that thing that my child can tolerate? What is that play that my child can tolerate? What is that play that is not stressful for my child? What is that thing that is stressful for my child? Even though it can be a very common thing. See, some of us with sickle cell, they might be able to do some big work, do it, but they might not be able to do one particular small thing because that one stresses them. So you're wondering, they should be able to do this light one. Why they shouldn't be doing that one, but their body can actually perform better with that one that you call stressful. I can struggle with that one that you think it's easier. It just depends on individual. So that's the reason why you must know what is that activity that they can tolerate. It helps you to make a very good decision. It helps you to make good decision based on informed knowledge. Ewo. Please, have you been hearing me? Have you been hearing me? Is it? Can you hear me? I don't know. I guess I pressed something that mutes me. Can you hear me? If you can hear me, please let me know in the comment section. I don't want to know. I don't know. Maybe I have to explain this again. Is it possible? Can you hear me? Let me see your comments if you can hear me. I don't know, but I have to go through this again. Okay. Okay. Thank you, ma. Um, I'm looking for this. Okay. Oh, there is a particular part slide that is missing. So let me just talk about that slide before I talk about other things. So now one of the things that you must know is the hemoglobin and blood count of your child. That is stable PCV. And the question you want to ask me is, how do I know my child's stable PCV? I thought I designed this slide, but I don't know what happened now. It's not here. Why do I know my child's stable PCV? Stable PCV is one of those important things that you must know. Hemoglobin, stable PCV. So it depends on your hospital. If your hospital is often using hemoglobin, then you must understand the hemoglobin. You must know where your child stand. You must know where your child, what is normal for your child. So if they use PCV, which is the most common one in all of our hospitals in Nigeria, mostly we use PCV. So I'm going to keep using the word PCV in order to explain this hemoglobin and blood count. So it is important for you to know your child fat cell volume, PCV, to be able to determine so many things with your child. See, with the PCV, you can easily know when your child is anemic, right? You can easily know when there is a lot of hemolytic crisis going on with your child, because you know hemolytic crisis doesn't come with pain. It means that the red blood cell is just breaking down at a very faster rate. So you must be able to know this is it. And even though if there is infection, one of those things that breaks the hemoglobin too, that breaks the red blood cell faster, is also infection and malaria, because malaria affects the red blood cells. It keeps using the red blood cells to breed. So if your child with sickle cell has malaria, it's going to affect their PCV level. If they have infection, it's going to affect their PCV level. If they have crisis, sometimes it affects their PCV level, right? And if they're going through hemolytic crisis, splenic or hepatic sequestration type of crisis, where it will affect the PCV. And this is important because every time you go to hospital, one of the things that is very important for your child to know is the PCV. So sometimes when you're going for the checkup, they tell you that you must be able, right? They tell you that you should always come with the PCV before you see a doctor. In some hospitals, maybe teaching hospital or federal medical staff, like for example, now if I'm going to see my hematologist, before I see my hematologist, I must get a PCV done that same day. I must get a PCV done that same thing. And I know there's some hospitals that they will see your child before they start writing other tests for the child. But for the clinic that I use, we have to see the PCV. That's the pass. If you are not seeing the PCV, you're not going to see the doctor. So once they see the PCV, then it's helps them to make decision. Now, every time we have to talk about blood transfusion, knowing your child baseline PCV, your child's stable PCV, help your doctor to know when to add transfuse. Transfusion can be late, and some transfusion might not be necessarily needed. That's just truth that can coexist. Sometimes, because the doctor don't know your child's stable PCV, they can transfuse even when it is not needed. And another thing is that because your child's stable PCV is not known, they might delay transfusion even when it is needed. Are we getting it now? Even when it is needed. So it means that if you know it, you are actually helping your child to be able to have access to the right treatment at the right time. Now, how do you know your child's stable PCV? This is the method I use. When your child is not sick, when your child is the optimal level, they are not sick, they are not having that fatigue, they are doing well, go to the hospital and get their PCV done. When you get it done, repeat every 2 weeks for 3 times. Every 2 weeks for 3 times. So it means that if you do it today, you do it 2 Saturdays. eh, you when you do it today, then you can't Saturday one, Saturday two, that is 2 weeks. Then you do it at that time. Then you cut another 2 weeks and you do it. Then you cut another 2 weeks and you do it, making 3 times. At that 3 times, you can easily see the records. So you can easily see what your child maintain per time. Some people will say that you can do it once a month when your child is very stable. But this is the method that has been working for me and for my clients. So you just do it when your child is not sick. You know that time that they are always jumping up and down. They are not sick. That nothing is wrong with them. They are doing well. They are at the ultra level. That's when you know. By the time you do the PCV, you are able to know that, okay, what is that? Is it 24 that you get? That's stable PCV. Then you want to confirm 2 weeks. 2 weeks later, you confirm. You can do it and it's 24 or it's 23. It's okay. It's still within range. Then you do it the third time, and it can also be maybe 24. By the time you check it, you realize that 24, 24, 23. Then when they ask you the question, just tell them, oh, it's always between 23 and 24. This will help the doctor to make a sound decision. To make a sound decision. Child is now go to the hospital and the child now has a PCV of 18% and the stable is 24. The child will get blood transfusion and it's okay. And it's very okay because at that 18%, your child heart will already be struggling. That's when you realize that there is palpitation. The child is having a rapid breathing. They are breathing very heavily. They are always tired. When the normal work that they're supposed to do, even though when you look like they're okay, they be struggling. Sometimes they might not talk, but you can notice that when you send them to go and bring something, by the time they come back, they are breathing heavily. It's because they're tired. Sometimes they might not be able to say, especially children, they want to play. They don't want to, until that thing hook them down, they will not tell you. Or you start noticing that even when they sleep, they start having a very heavy rapid heartbeat. So it's already telling you. So by the time you now get to the hospital, even though there is no other symptoms, you see these two symptoms: the child is weak, the child is having rapid heartbeat, is an enough sign. And then by the time they now check the PCV, they now say, oh, the PCV is 80%. Please just allow the child to go and take blood transfusion like that, so that you don't overwork your child's heart and other organs, which is very important for us. Living with sickle cell already put these organs at risk. So by the time this is, and some of these blood transfusion that we are giving is a sign of treatment in order to prevent some of these complications from happening. So when now, why you already know, and by the time the doctor is not telling you that we'll be doing blood transfusion, you just ask the right question. Why? Oh, I know. I believe so because this. Or by the time you are asking question, okay, what is the best alternatives? Or you're trying to ask question, okay, why do you suggest blood transfusion? I know this is low, but why do you suggest blood transfusion? Then the doctor can easily explain in a simple language where you understand. Do you get it? They can easily explain, and you can easily know that this is the right method of treatment that the doctor is giving me. So there is no friction. It's not like you're not start fighting. Hey, why are they trying to transfuse my child? It's because they're trying to look for money. It's because of you are not going to come. You are trying to ask because you can easily accept, because you know that there is an issue. 5% in a particular blood for someone with sickle cell loss, it is already huge. The organs will suffer. And now I'm going to use this opportunity to talk about all these things that we call blood boosting. See, when a child with sickle cell, when is they are at that level of that anemic, that they start having weakness, they start having rapid beating, they start having many times they have sickling, but their sickling is high, right? By the time you start giving this a lot of this busting, whatever, I don't want to mention this particular leaf that you had milk to. There's a this particular leaf, they said it is red, blood of Jesus, you add milk to it. Then there's another one, this concoction, tea, tomato, and paste. They say go and start giving it to her. Sometimes when you give, you go back to the hospital. You give, you load your child with it, and then you go back to the hospital, and then you go and check. Sometimes there is an increase in the blood, right? You realize that, oh, it has moved from 18% to 20. The doctor might suggest, but there is something that happened. Your child keeps struggling. Yes, your child keeps struggling. You notice that despite the fact that you are spending, see, that thing is more expensive than blood transfusion. That time when you start, I'm talking for someone with sickle cell, that because it is a different peculiar case. That time you now get to the hospital, you start drinking it, you start doing that. I even know when there is an increase. The increase doesn't reduce that rapid heartbeat. It doesn't reduce that because at that point they need another blood kind of blood that can easily send oxygenated, that can easily send oxygenated blood around their organs and allow their organs to pick up faster. To pick up faster. If not, by the time the child see anything that has to do with organs, the damage doesn't show up in day one. 10 years later, that's when, but then 10 years later, then you start having issues. Then they start telling you the heart is enlarged. The child comes down with heart attack. The child has issues with their, then you are running etasketa. You do ECG today, you do echo tomorrow, you do this. When we talk about, oh, these are the things you're supposed to do every year. So people will not listen to us. They don't want to do it every day because, no. But do you realize even though if you are doing it any year, it is actually easy for them to diagnose it faster. But no, we just want to prove. Every time those organs they begin to struggle, they keep struggling. Then you are wondering, but the PCV is, look at the PCV has improved. Why is this child still struggling? It's because whatever you are giving the child is giving a false hope for you. It's not really doing the work. It's not really helping the child. The child organs are still struggling. But immediately there's, ask anybody with sickle cell, after a blood transfusion, there is a way our body feels. It feels all right. That weakness disappears in the space of 1 week. You are able to do so many things after blood transfusion because that is why they advise that you should give AA blood. By the time you give that AA blood, your body blood cells that are not sickled, they are taking it throughout the world, and these organs they have access to it and they start to function optimally. I'm saying this so that we can understand and make the best decision. So this week, one of the things you're going to do is to start to know your child's stable PCV. It's not that time that you go to the hospital that you want to know stable PCV. Know it now. Do it today, tomorrow, Monday, any day that you choose from next week. Check one day, let them do the PCV, then note it down. 2 weeks later, do another one, note it down. Another 2 weeks time, do it and note it down. Then you'll be able to see a pattern with that. If your child is sick, you will not be able to get that stable PCV. You will only get PCV that when they are always sick. No, because sometimes when you say that, oh, I'm doing the PCV when they are sick, you are not getting the optimal. So whatever you are seeing at that time, it means that the PCV might already be low due to the presence of, due to the fact that the body has been, the child is sick, the red blood cell has breaking down, and some other things have happened within the body. So you will not get an accurate result. That's why I say do it when your child is okay, when they are not sick, when they are at their optimal level. So now let's talk about this oxygen saturation. I talked about oxygen saturation for us. I think that was last week that we talked about. Was it last week that we talked about monitoring oxygen saturation? The oxygen saturation helps your child with sickle cell because see, when the SpO2, when it decreases, it causes so many things in your child with sickle cell. The oxygenation occur faster. the blood begin to sickle at a faster rate, right? It began to sickle at a faster rate. And that's nothing. It means that your child is struggling to be able to send oxygen to the major part of the body. Now, these things happen, right? And when you are at home, sometimes our child start having what is it called? Start to struggle with their breathing. If you regularly check their SpO2, you can easily know when they are struggling with their breathing, because it means that they cannot breathe properly, right? They cannot take in oxygen in the right way, and they cannot exhale CO2, and that causes problem. Their body, their lungs, their other organs begin to struggle with it. So what are you supposed to do? Now, there's always a baseline for someone with sickle cell compared to another. Every time we said, oh, if the SpO2, the normal SpO2 for somebody might be 90% to 96%. But for your child, it might actually be maybe 94. That 94 is okay. Anything that is now below 90% downward, it shows that there is a problem. So sometimes during this SPO2, you want to check, especially when the child is in crisis, when you are doing home management, you want to show so that you know when you are supposed to seek hospital support immediately. See, if you get to the doctor and you're telling the doctor that, oh, doctor, when I got to the, I checked the SpO2 at home, and I realized that the SpO2 is at 87, or maybe 70, or let me even say 85%. I checked that it is 85%, and that is the reason why we are here. You are communicating a language where the doctor understand that this person knows what is saying. I said, okay, immediately they want to place the child on oxygen to help the child. They want to place the child on oxygen. Now, consistent tracking help prevent silent hypoxia and crisis. See, sometimes when the SpO2 can actually tell you when sickling is high in the body. Yes, it can easily help you tell you when something is about to go wrong in the body. And when I say it prevents silent hypoxia, what is hypoxia? Hypoxia is a medical condition that occur when there is no enough oxygen reaching the body tissues. When there is not enough oxygen, and this thing can be very, very silent in people with sickle cell. They look healthy. That's why we call it invisible disease. They look healthy to you, but something is already going so wrong in their body. Their body is breaking down. Things are not well with their body. But when you can monitor some of these things at home, it can easily tell you when to seek hospital. See, sometimes when you check this thing, by the time by in the next second day, it can actually lead to an emergency. But when you are checking it now, you already notice this sign, and you can easily like, oh, there's a problem. Then let's go to the hospital. Sometimes they might not even admit. They might just, okay, let's do this. The child is okay. Then we going home. It helps you better, right? Now, what are the other things that you monitors? What do we use in measuring this SpO2? I forgot. It's pulse oximeter, and it's cheap. It's cheap to buy. It's not expensive. It's not expensive. You can easily look for it and get it. It's between 4,000, 5,000, 6,000. In fact, it's not even up to that before. But now I think it's a little bit expensive. So it's something you can get for 5,000. Yeah. So have it and you check it. You might not check every day. You might check once in 3 days. You might check once a week. Or you check when the child is in crisis or when they are sick. It helps you to make the right decision. Now, jaundice. When we talk about observation, uh, jaundice, what is jaundice? This jaundice is the yellowing eyes, yellow of the skin or eyes. See, you must be able to know when there is another layer of jaundice in your child skin or eyes. There are some people that when you constantly drink water, I'm going to say it, you are likely going to have a very clear eyes if you are consistent about it. If your child is consistent about drinking water, they are going to have a clear. When they don't have a clear eye, it means there can be another form of trouble. Another form of trouble. There's something that happened some other day, and then there is this client that I have, and when, I think when they brought the child to my office, the first thing somebody referred them to me, and the first thing I could actually notice was the yellowness of the eyes. And the mother was like, the eyes is yellow and blah blah blah. They were using a private hospital. And then the doctor, like, I said, okay, go and we have to run some tests and then something. And then that's why we run those tests. And I send the test and every other thing because that's the hospital they said they use, they have an health insurance thing. Send the doctor the reports and everything test, wrote another report, attach it to it, and send it to go and meet the doctor. And when they get there, the doctor dismiss it. I said, what kind of nonsense is that? That is how it is normal. People with sickle cell, their eyes are always yellow. Their eyes are always yellow. And I was telling the doctor, if you have been the one managing this child, I don't know, I'm going to. I take the child to the I went to go and meet the doctor myself because it's in my environment. I went to go and meet the doctor and I said, Doctor, I said, Doctor, did you actually check my report? And the doctor said, I'm telling you, that's not a problem. It was at that point I talked to the woman, I talked to the mother, I said, we need to refer from this hospital. I know you have a health insurance here, but we need to refer to this hospital from this hospital because the test we run, the liver function test and hepatitis B shows there is something wrong, clearly wrong, and this doctor dismissed it. Why? And before we run that test, when I saw the yellow eyes, the first thing we have to do is hydration. After hydrating for 48 hours extremely well, there was no difference. So it already shows something else is wrong. And that's the reason why you must understand jaundice. Understand when it is deeper. Understand what it means for your child. I can easily look at my eyes and know that malaria is coming because there's going to be a slight it's possible for me to wake up early in the morning and notice there's a slight yellowness in my eyes, and that can easily tell me what is wrong with my body. And before even that, I mean, I've seen other thing. Maybe my urine has been darker than normal, or I've been struggling with drinking of water, and that can easily tell. So now for people who might not be able to have that high level of awareness, which I want us to have, follow the jaundice. A lot of parents can tell when their child is about to fall sick just with that jaundice, but just by notice that my child eye has become more yellow and the skin has become paler. So you want to know what is the usual color when my child is well hydrated. What is the usual color of their eyes and their skin? What is the usual color? What is it? Is it slight yellow? Is it clear white? Is there a little bit of I don't know. You just want to know it. And then when there is a sudden, or you know that there is a increase in that color that you can see, you can easily predict that something is coming, right? So what are you do? You can do something, you can take picture if needed. You can take picture. But I know that a lot of parents, they are extremely at alert. They can easily tell the difference. They might not even need to take photo. Just looking at the child, they can easily predict. And yes, I salute every parent that is listening to me right now. I salute all of us, and I understand that it takes a lot of work. There's something you call parental instinct, and it can always help us. So some of people might not need to take photos, but you might need to take photos in case you want to explain to other family members or explain to the class teacher, or explain to other people. Maybe you have a nanny, or you have somebody else that help you at home. You might want to give them for a need for comparison. You know that I always talk about partnership when it comes to raising your child, because sometimes you don't have the time, right? Sometimes you don't have the time, and sometimes you need people to be able to support you when taking care of child. So they need to be able to also know the normal and know when there is a slight shame, so that every one of you can come together and make an decision. And as your child grow older, please start teaching them these things. Start teaching them to know, so that they can easily tell you, they can easily know that something is about to wrong. Start teaching them, start telling your child this is their normal body temperature when nothing is wrong with them. This is a sign that a fever is coming. Teach them all this normal baseline. Teach them their SpO2, because if you constantly measure your child SpO2, at a point in time they want to know what is it. So depending on the age, use an age appropriate um what is it called, use an age appropriate language. When you are talking to them, talk in a language they can understand. Tell them what is the name, what is it for, and this is normal. When this thing is not the same, then this means there is a problem. According to their age, you can easily tell them, oh, we are trying to check for oxygen in your body. Check for yourself first, check for other people at home. Yes, because sometimes you don't want to keep doing for that child alone. Other child also matters. Yes, so when you are checking their body temperature, one way for you to get compliance is because you involve other people in the family. So when you're checking that child temperature, also check for their for the siblings. Let the sibling be aware that you also care for them, so that you don't have issues. Tracking activities and hydration. You know, I've always talked about it. There is always activity tolerance. Know your child normal energy level and when the fatigue is sudden. You know, sometimes there's something we used to talk about when we deal with fatigue. As someone who has dealt with chronic fatigue for a very long time, I can easily tell you fatigue is one of those things that we often overlook when it comes to management a child with sickle cell. Now, even adult sickle cell warriors, some of them don't know what it means for them to have an unusual fatigue. Now, let me say there is a level of my energy every day. Even though I'm dealing with fatigue, there is a level to my energy. So it means that when I'm fine, I can easily do some things normally. But there are some days that you wake up and you suddenly cannot stand up from your bed. You are too weak. You are lying down. You are telling them, I feel so tired today. I'm so tired. And they say, stand up. Say, they say, eat. You cannot even eat. You see, at that time, there is fire on the mountain. There is fire on the mountain. There is fire on the mountain. It is not normal. Unusual fatigue for your child is not normal. So the child suddenly wakes up and they start telling you, Mommy, I don't think I want to get down from bed. Mommy, I want to sleep more. Mommy, I feel more tired. Something is wrong. So it is time for you to check the PCV. It is time to go to the hospital so that they can actually, is the child hydrated well? They want to check the PCV, then they want to check all for other things. They want to check for the SpO2. They want to check and see where the problem is. So unusual fatigue, it is not a normal thing. So sometimes people will say, oh, I cannot go to work. I miss work today because I just have to deal with unusual fatigue. And then you see some people stay at home. They are at home. They keep managing that unusual fatigue till it turned out to become something bigger. Unusual fatigue is not a normal thing. There is a level of your child normal energy. You will know. You will know the activity they do every day when their energy is normal. You will know the kind of play. When they are dealing with fatigue, see, you cannot hide it. That child want to sleep because that's the only thing they want to do. That child want to sleep or they don't want to mingle. They are trying to preserve their energy because the energy is not even, the only thing the energy is is for their body to just wash or breathe. That's the only thing they can do with that energy. Right? And most time it's also common when there is an anemia, there is a severe anemia. Sometimes that's exactly what is happening, severe anemia. So it means that the organs are already struggling and then you must do something. Not that when they say the child is having, then you see some parents they start to give glucose. They want to go and give some things. No, it might really help them a little bit, but in 1 hour's time they are back to that normal, and it can easily affect the child. So if the child is severely anemic, what does that child need? Blood transfusion. So it's not your glucose that will help. The glucose will not help. Track fluid intake daily. Check the water daily. I track the water your child is taking daily. Track it every day. Don't joke about it. Track it every day. Check their urine color every day. Work together with your child to be able to accept that. Monitor changes in their behavior or appetite. If their appetite is low, you want to know. You want to know that, okay, he's already telling us that something is about to be wrong. Right? You want to tell them that. You want to tell them, track fluid, monitor changes in their appetite. So when the child has low appetite, it might actually be a sign that something is wrong. Something is wrong. It could be anything. It could even be anemia, it could be malaria, it could be infection, it could be anything. So you want to monitor for changes in their appetite. When your child, why does your child baseline changes over time? Baseline changes. And I want us to know that baseline changes. It means that you have to sometimes when we talk about regularly monitoring, people are like, these people, they are trying to kill us. We do too much. And I'm always asking, I do it. I do it. I do it every time. Even though if I've been to the hospital last week, for example, last week I was at the hospital. Let's say last week I was at the hospital, for example, and this week I needed to travel. I will not say because I have traveled, because I have gone to the hospital last week, I'm not going to check before traveling. Why? Because I understand there could be changes. So in preparation for my traveling, I might be stressed emotionally. I might be stressed physically, trying to prepare what to pack down. Am I going to travel with my child? Am I allowing my child to stay? So what are those things I needed to prepare in case I will not be at home? Okay, what is those things? Those things can add an extra stress. Sometimes I need to do some work. I need to increase my, I need to work overnight in order to deliver on some services or some work. And I have to do it. And because of that, it might affect my blood work. So I have to check again and take necessary precaution. It even allow me to know how to behave wherever I'm going to for work. I'm just saying it. So, and now your child baseline changes over time. Every time you put effort, I have experienced this. Baseline, a PCV, has gone up in the last 4 years. It has gone up in the last 15 years. And it has come down in the last 5 years. Now, before I got to know about sickle cell management, my PCV baseline was extremely low, maybe 20. But because of consistent in my management, I started seeing increase 25, 23, 24, 25, 26, 27, 28, 29. Stop. After I finished, I gave birth. Then I noticed a decline because I was dealing with severe anemia then. It declined. And from that time till now, It has increased. Management, food, diets, lifestyle changes, lifestyle modification, modification. All this has helped, right? See, as your child grows, it affects the baseline. It affects their baseline. Growth and development affect lab values and symptoms. So we must immune treatment, for example, like hydroxyurea, can improve baselines. For those who are on hydroxyurea, those some people where their child are on hydroxyurea, this treatment can actually help you in changing. Sometimes the food, when you change your diet, it shows in your child baseline. Sometimes when you get some supplements and you started incorporating into your diet, it change your child baseline, and you can easily know what works or what is not working. Environmental changes and new complications can alter the new normal, right? So it means that if this is a normal that we have been following, because of one complication, that normal can drop or it can increase. Regulate update. So you have to constantly do this monitoring in order for you to regular update, to be able to know when these changes occur. Regular updates ensure that you can ensure that their care is personalized. What to track regularly? I've mentioned it: hemoglobin and FBC. Now, FBC is food blood count. Most times, what we track in FBC, it's your PCV, your WBC, which is white blood count, and the platelets and the reticulum. Those are the things that we check, right? Because the WBC can actually give an insight on if your child is dealing with an infection, and that's what we use in tracking infection in people with sickle cell. But now there's something I want to tell, because there's always, you notice that some child with sickle cell, even the child is not sick, the child is not showing any symptom, you went to go and check. There are people with sickle cell can easily have a slightly elevated WBC, and it doesn't mean they are dealing with infection. And you must be able to know that this is the baseline. It doesn't mean the child is dealing with infection. It doesn't mean that the child is dealing with infection. It just means that that is the child normal. WBC. Do you understand? So you have to be able to check for that WBC and know the normal, this stable figure. So some there is always slightly. Some, if they say the normal is 10, and then you have some people with sickle cell that their normal is not 10, their normal is 10.5. Their normal, some people their normal is not 10.5. Their normal is 11 point is 11, and you should be able to differentiate this. So elevated white blood cell can happen because of sickle cell and the presence of inflammation due to sickling of the red blood cells, and it doesn't mean your child has it. But immediately this figure increases slightly, it's already showing a sign of infection. So I talk about the oxygen saturation weekly or when unwell. Hemoglobin and FBC is something that we constantly check when you go for clinic visit. During your routine checkup, when you go for it, you can easily get it. Pain episode, daily or weekly, it depends on how your child has pain episode. So you want to check for some parameter. So jaundice appearance, check every time, check, continue check. Activities for hydration, check daily. It's okay. So when to update your child baseline, if the lab values is shifting consistently, you must be on your toe to constantly monitor it. If there is a new pain area, sometimes some child start developing pain, maybe on their hips and every other thing, you need to be able to know and look for to check it. Increase frequency, like I said, in the space of maybe WBC, you get to the hospital, the WBC is elevated, very, very high. It shows something is wrong. There is a presence of infection, and then you need to get it treated. Changes in energy or recovery time. People with sickle cell takes a longer time to recover compared to those that doesn't need a sickle cell, right? So when there is a changes in energy, you want to check, you want to update your child baseline. Frequent visit to hospital or new symptoms. Are you starting a new treatment or a medication? This can also help you to know how effective some of this medication and treatment that we are taking. Now, sharing your baseline information with your doctor. For us, I would tell us that you should be able to discuss it, you should be able to know it. If you have a diary, you can easily, when you are going for the hospital visit, you can easily take it and share it with the doctor and said, oh, throughout the week, this is exactly what you have done. This is it, and this is what. And the doctor can actually look at it and be able to help you to make a very good, request reassessment in case of those people. There are some tests that we must do when it comes to sickle cell. This is there is a test we must do every month, every, it depends, yearly, in order for you to is performing, and you can actually have a reassessment of these figures every 6 months. Collaborate on care decision based on your baseline data. So when you have this information at hand, it helps you and your doctor to be able to come together and collaborating on making decisions that work every time. So what about key takeaway? Knowing your child clinical baseline, improve care and safety. Whatever I'm trying to tell you is that when you know this thing, it helps you to improve the kind of care you give to your child and the safety of your child. So you are not delaying, what is it called? You are not delaying treatment. Yeah. So we are the last one. I think this is our network. This is our network sometimes with the way it does. So key takeaways. Knowing your child clinical baseline improves care and safety. So that time when your child needs blood transfusion, they are able to make decision that it helps you to save your child's life at the right time. That time when there is no need for transfusion, the doctor can easily predict. That time when there's a child that has a little bit elevated WBC, and you know that this is the normal baseline. So it means that you can stay away from unnecessary antibiotics that is not needed, because you know that this is the baseline. Even though every time the child does it and the child is fine, this is the normal uh, my side. Ah, slide. You just have the last slide to go, and I don't know. I don't know what is going on with my network provider. So, okay, this is the key takeaways. Like I said, when a child has an elevated WBC and then you already know that this is the baseline, you can easily know this and then it saves your child from unnecessary taking of antibiotics when something is wrong with the child. Yes, because you know that there's a slight increase. You know that this is not because there is an infection. This has been the stable baseline. And the same thing with the PCV too. It helps you to take blood transfusion at the right time when needed and also reduce unnecessary blood transfusion. There's one of these of my client that I have that time. I think anytime she took the child to the hospital and the child PCV is 25%, they just go there and keep transfusing the child until they got to know me. I was like, oh, there's nothing wrong with the child having a PCV of 25. There's nothing wrong. That is this child's stable PCV. And that was exactly what stopped because the mother did not even open up to the doctor and said that the child has been diagnosed for sickle cell. The doctor did not open up. And because the doctor did not open up, the parent did not open up. So the doctor assumed that this child doesn't need sickle cell and keep transfusing at 25 until they have to talk. I have to tell the mother the effect of what she's doing. If your child may be sickle cell, it is important for you to explain and talk to your doctor that your child is living with sickle cell and let your doctor be able to make the right choices. If not, why is a child 25% keep? And the same thing also happen in sickle cell. So when we don't know your regular blood transfusion, there are some people that are 24, they are supposed to take blood transfusion because of their baseline, but because you don't know, you're going to be neglected, and before you know it, another thing can happen. So it helps with to improve care and safety of your child. You can easily determine when there is a problem, when the jaundice is there, when the jaundice has increased. Check the SpO2 when there is difficulty in breathing, or when you can easily tell that, oh, this child is already going into a state of this hypoxia, the body is not able to send oxygen to the tissues and the organs, and then it's an emergency that you need to take your child to the hospital. When you check the temperature, the normal body temperature, you can easily know the normal and know that when there is a presence of fever based on your child baseline. So you know that somebody that has a 36.8, for example, as their normal baseline, or 36.5 as their normal baseline, by the time they see 37.1, it's already telling them that there is a low grade fever silently for the child. But for somebody that has maybe 37.1, they can easily know that, oh, this is okay, but there is the 37.1. They can easily see that. I know that, oh, nothing is wrong with my child. That has always been the normal blood body temperature. Regular tracking and updating is essential. No matter what you do, there is always a need to keep tracking and to update when, because as you keep practicing treatment management, as you keep practicing it, drinking of good water, improving your diet, reducing your stress, anything that has to do with prevention of sickle cell crisis, it can help will you to have a it can help you to increase or decrease your baseline before, depending on what you are tracking. So at this time, updating, regular tracking and updating is very, very essential. Share baseline data openly with your healthcare team. No matter what you are checking, share it with your healthcare. It helps to place your child in a way where they can easily monitor and easily make decisions. See, no matter what you say, your doctor actually has the right to tell you that this is exactly what to do. But when you share this kind of information with them, you enhance their informed decision ability. They are able to make decisions based on what they know, and it can help your child. Empower yourself with knowledge to increase crisis and quality of life. So every time you know whatever we are teaching you, you know the baseline, you can easily empower yourself with knowledge and reduce crisis and improve quality of life. This is going to be, and this is thank you. Thank you. It has been 1 hour plus. And I want to appreciate everybody for turning up. I want to appreciate people that show up. The replay will always be here. And I see you again next Saturday, where we talk about another topic in related to your child. And this is Sickle for parents that have children with sickle cell, where we expand your knowledge equipping you with enough empowerment to be able to manage your child's sickle cell from a place of an informed decision. You have access to the right tools, the right knowledge, and you are able to make decision based on the right information. Until next week. So do not forget to do whatever you're supposed to do. Do not forget to start working on your child baseline. Don't know that there is no, it's not as if it's not rushing. Do what you can do part time. Start with maybe the say thank you and God bless you. So I want to say thank you and God bless you. See you tomorrow and bye. See you next week Saturday. Oh God, see you next week Saturday and bye. You can always have access to me via our group chat. You can always send message to me. Thank you and God bless you.